So over a couple years, I'm an epidemiologist, and I can't resist but to show some numbers, because sometimes that's helpful. We were able to train 4 non-physician clinicians, or so physician assistants and nurses, and about 50 community health workers to train, diagnose, and manage people with the drugs. We have put about 300 patients now on treatment and tested about 2,000 people in the communities. So about 2,000 more people know their status. When we started, there was about 87 people have been tested in the community. And most importantly, I think that we've been focusing on job employment, and we've seen a reduction in stigma because there is access to drugs, and because we've been focusing on bringing people out of this extremely marginalized situation into job employment as well. And now that HEI, or HIV equity, is just serving as a national model for task shifting, which is just a public health term, but really a model for saying that community health workers should be part of this as well, for delivering complex health interventions like HIV treatment. Then again, this is just some data to show. A lot of people like to ask, well, what was the real impact of this work? And all of us in the activist and advocacy movement have to show this data, because the people with the bucks want to know the numbers. And so this is the impact of our community health workers in terms of improving survival and retention. So keeping people in care, which is a hard thing to do when you have a lifelong disease like HIV, at 12 months of our program. So the dotted line here is showing people who actually have community health workers, and that shows that about 85% of them are alive and in care at a year. And at the bottom solid lines, actually, there's only about 30% that are alive and in care with community health workers. If you compare this data to the other parts of the country where there are rural health facilities also providing HIV care, we find that this number here is actually where a lot of facilities are. About 30 to 40%, even maybe a little bit better than this, but about 30 to 40% of people drop out of care after the first year, which of course means really life or death for those patients. But I don't think any of this, really a conversation about HIV and labor can't be complete without really focusing on the stories beyond the numbers. And this is Mary, one of our first patients, and she's always been proactive about wanting to share her story with others, and of course gave us permission so she said, you better show my picture actually and show the changes that have been made. I'll just tell you a little bit about Mary's story. She is a subsistence farmer and former refugee in Ivory Coast. She spent 15 years there, had 4 children, and 2 of those died because of diarrhea. Her husband was killed by rebels during the war, and when we first met her, she was emaciated as she looks there and suffering from AIDS. And she asked us, how can so much of this happen just to one person? How is that fair? And when we worked with her, and she was connected to some of our community health workers, and within 6 months, she, by getting food support, by getting drugs, by getting some home-based care, so being just stuck in the hospital, this is how she looked with that treatment. And now she's employed with us, not just improved in terms of her medical care and her health, but she's actually employed for the first time in her life. She's never had a formal job. She's been living deep in a forest doing subsistence farming. Now she works with us as a community health facilitator and is part of our leadership team. And again, it wouldn't be a complete story without talking about some of the people behind the community health worker program. This is Weefus here, who is also a former refugee, spent 17 years exiled in Cote d'Ivoire in Ivory Coast, and was peddling kerosene across the Ivorian border to etch out a survival for his family. That was his main trade. When we started working together, he was our first community health worker, and actually founded Yatain Health with his colleagues, didn't even know about a year ago, didn't even know how to turn the on button for a computer, where the on button was for a computer, and now is running the largest rural HIV care program in the country and does it well. He also is enjoying Gmail chat and using emoji icons like the link buttons. I think is favorite. This is him at one of our awareness activities, which actually just happened last week at one of the town halls there. And again, as I mentioned, this really what we're hoping to put forward is to say that if we link this movement for health, for HIV, to communities, and we get them involved, as we we have in this country so well, we can really focus on the poverty issues, the root causes of this epidemic that also cause other diseases and also cause people to not be able to access schools. So our folks work with patients to start small businesses, to do agricultural activities, rice planting, and we've seen numbers of them really move from being extremely poor to moving up the society and then helping others do the same. So we really see this virtuous social cycle occurring in that setting. And some of the lessons learned, as I mentioned earlier, there's increased access, but community health workers we found that can actually maintain quality of care, maybe even better than doctors do in that setting. At least doctors alone couldn't be able to do it themselves. So they increase their value. And as I mentioned, we find that you can't address this epidemic without working on social and economic protection for the poor, because they're the hardest hit by this disease, and expanding basic social and economic rights. I wish I could stay longer for the Q&A, but as I mentioned, I have to go back to the hospital. I do want to say that I hope that we'll get a chance for more conversations later. And our intention really is to show that community health workers can reshape the way we address the crisis of poverty and violence in the world. So this is our website, and my email is there. If I'd love to have more conversations